Hi. Sorry about that. I'm here to make a video about the patient's preference or clinical expertise. And we're supposed to make this question video, impromptu, but I kind of read the questions first and then I made a like an answer to an idea at least, you know. And the first question is what ethical principles are in conflict in this situation regarding the video that we watch in Lippincott about patient autonomy, beneficence, non-maleficence, and dignity. How would you prioritize them? To me, I always want to ask the patient's preference. And I talk to them and I ask them what would they like, what would they want to prefer, how to do it if I'm giving a task to do it. um so the autonomy, of what I kind of read in the book, it says, make the patient make a decision for themselves. It's kind of like an informed decision. If they have the right mind, then you would ask them and you would want to work with them on what they want it done and how they want it done. And then the beneficence is, as a caregiver, we have a duty um to in the best of interest of the patient. So we want to always be in their side. What's the best for them, the best for their care. And non-maleficence is our duty and obligation to the patients to do no harm. You always want to try the best that we don't want to hurt them and we're here to help them. And then dignity. So it's kind of like an example where you're trying to change a brief and then we're in a hallway. So what we can do is to actually use curtains, movable curtains to actually cover half of the body while we're cleaning the other half. Use all the equipments that is available to help them with their dignity. Always respect their wishes, you know, a no is a no, and you can ask them why and then we can listen. And what we can do is try to do our best to actually do our duty, to do our job, the task that we needed to do to help them. And number two, bargaining. So for bargain, I would probably try to refrain my question. And I don't wanna do a power struggle. I kinda have this pin in my uniform that says live. I'm a liver. I'm not a fighter. So to me, I I don't wanna fight. I wanna help them, and then if they don't want to, they can refuse. It's okay. And I just have to document it. Or I can refrain it and then maybe I can ask him, how would you want it to do? How do you want me to help you? And then number three, question what the additional strategies that could be used to promote patient safety or respecting cultural personal preference. Well, there's always a schooling or an education in in facility that I'm working with. So I will want to join and collaborate and ask questions about the cultural different cultural beliefs of a person, and that way I might be able to um find find out a thing or two, and that would help a lot. um Number four, how could I collaboration with health team members, family, and friends help Mr. Johnson on the recovery process? I can always collaborate with the other healthcare to assist the patient. And I can always educate the family on what the orders or the doctor wants it to help, how the patient would the need and needs to be done, so I can always educate the family and help the patient, their family member, on how to get the things done for his care and his safety. Thank you.